I'm Dr. Ethan Kobe. I'm a physician with the Washington Health System, and I practice here at the clinic in North Main in Washington, Pennsylvania. I chose family medicine primarily because I really like getting to know people. I like forming that relationship. It's a long-term relationship, and really caring for the whole person, whether it's emotional health, physical health, all that stuff. So as many of you may know already, tick season here is in full swing, and Pennsylvania has led the nation in reported Lyme disease cases over the recent years. There are 4 main ticks that we see here in Pennsylvania. The most common one would be the American dog tick. That does transmit a disease not that commonly seen in this area called Rocky Mountain spotted fever. One that we're all very familiar with though is the deer tick, also called the black-legged tick. This is the tick that is responsible for transmitting Lyme disease. It's a bacterium that can be seen fairly rampantly here in this area. So there's 2 other ticks that we see in Pennsylvania and along the eastern seaboard in general. The groundhog tick and the Lone Star tick. Neither of those ticks are all that common, but we do definitely see them. All 4 of these ticks can transmit tick-borne illnesses, but again, most commonly in this area would be Lyme disease. So with Lyme disease, we all are very familiar with the kind of classic bullseye rash that we see that's present in a fairly high majority of patients that have Lyme disease, but not everybody. And then beyond that, you start having some systemic symptoms like fevers, chills, body aches, things like that. And a lot of the other tick-borne illnesses kind of carry similar symptoms, but the classic bullseye rash is very common with Lyme disease. Again, Rocky Mountain spotted fever is one that we see sometimes in this area from the American dog tick. The most common symptom we see with that initially would be a rash. Oftentimes it starts in the hands, along the wrists, and then ascends and goes up into the trunk. This disease, when caught early, is very treatable, but can cause some major complications if left untreated. Generally speaking, anytime you have a tick bite, though, you want to kind of watch for symptoms for about 30 days afterwards. So although ticks are pervasive in this area, there are ways to help prevent getting ticks, and then when you have them, obviously, finding them and getting them off. But one of the best ways to prevent them from getting on your skin in general is to wear long pants, preference for something that is a light color that you can easily see the ticks on. You want to tuck that into your boot or into your sock if you can. And obviously, you can get ticks anywhere just from being outside, so you're not going to be wearing long pants and tucking your socks in the dead of heat when it's 97 degrees. But if you're going to be outdoors, going on a hike or something of that nature, try to stick to the trails. Don't go too far off into the woods and that type of situation. But if you do, and if you're going backpacking or something of that kind, you can apply different types of bug sprays, things that contain DEET, 20% DEET, and off those kind of backwoods DEET ticks. Repellents are very effective, but they can be kind of irritating on the skin, so you want to apply those primarily to the clothes. So there are some repellents that would be maybe less abrasive for the skin, more natural, like oil of lemon and eucalyptus, and those are a much safer alternative for kids, especially kids that are under 3. You really don't want to be putting lots of chemicals on children because of the risks that they could pose in the future, and then irritation. So but ideally, once the tick is on you, you want to identify it quickly, and there are ways to do that. So obviously we don't want to keep kids from going outdoors and enjoying themselves, and adults either. But if you've been outside and you come inside, one of the best things to do is jump in the shower, ideally within a couple hours after being around tick prevalent areas. And the water can help sort of wash the ticks off, and then also with scrubbing and things, they'll fall off quickly, especially if they haven't attached. The other important thing is ticks like to be in areas that are warm, and moist, so like the armpits, the groin, the hair, along the buttock. And if you are vigilant about searching those areas, especially initially, then you'll be able to identify most ticks pretty quickly. And time is important with ticks because the longer the tick is attached, the more likely they are to spread those diseases. So after you come in from outside, obviously ticks can still remain on your clothes, so you can either throw them in the washing machine and then quickly into the dryer, or simply just into the hot dryer, and that amount of heat will kill the ticks. It's best to treat your animals that go outside with some kind of a tick repellent or a tick killing medication. However, if they do come inside on them, you want to make sure you are inspecting your animals, petting them, whatever it is that you find effective, to find these ticks and kill them before they attach to your pets and also to you and your loved ones. There are options to treat your yard so that you can reduce the risk of having ticks around the home. But because there are some risks with some of these chemicals and things, I would recommend that you consult some kind of a professional before doing so. So in the likely event that you have a tick on your body at some point over the next several months, the best thing you want to do to remove the tick, it's not to burn it or put oil on it or alcohol or whatever. You just want to use a simple pair of tweezers, grab it as close to the head, so as close to the skin as you possibly can, and then pull with kind of a firm, gentle pressure directly outwards. Don't twist it, because if you twist it, you could break the head off or leave the pinchers in or something of that kind, and that can lead to increased risk of transmission of these illnesses and also bacterial infections too. So in addition, when you finally get the tick off, in order to kill the tick, the best things to do would be either put it in some kind of rubbing alcohol or put it in a sealed plastic bag that will suffocate the tick. But if you do have the tick and you're going to go see your physician or your primary care provider, try to bring it with you. That way it can be identified to say, hey, is this a dog tick? Is this a deer tick? That kind of thing. Generally speaking, like I said before, if you have a tick bite and you definitely pull the tick off, you want to look for symptoms for about 30 days afterwards, because some of these rashes can appear anywhere from 3-4 days to a month. And if you have anything, a rash, headaches, fevers, chills, body aches, any of these things would warrant further investigation and contacting your primary care provider. So if you still have questions or concerns, you can call your healthcare provider. If you do not have a healthcare provider, there are a number of conveniently located clinics throughout the Washington health system, and you can go to WHS.org for more information.